Aloha guys, this is Dr. Tom Walker coming at you. This is our first video in pathophysiology. It's on human blood. So without further ado, let's get rolling, man. What blood does: transportation, oxygen, nutrients, waste throughout the body, regulation, temperature, acid-base balance, fluid electrolyte balance, protection against infection and bleeding. Easy enough. Characteristics of blood. Now, if you took a tube of human blood, guys, and you spun it down the centrifuge, this is what it would look like. The liquid portion of blood is known as plasma. It makes up approximately 55%. The solid portion are called formed elements. Here's the word. This is very important to know. They make up approximately 45%. And then right in the center, there's a little whitish yellowish coating called the buffy coat. These are actually the white blood cells. The formed elements are largely the red blood cells, and plasma is the liquid portion. This is very important to know. If you don't know this, there ain't no sense in going any further. Okay, whole blood viscosity is 3 to 5 times thicker than water. The pH is 7.35, 7.45. Is that important to know? Yeah. What's neutral in pH? 7. Plasma has water, electrolytes, ions, and waste. Plasma proteins, which you don't know what those are yet, albumin and clotting factors, gamma globulin, serum. This is important. If you take plasma, guys, and you remove the clotting factors from it, what you have left is called serum. Serum is used, blood serum, to do a lot of the tests and stuff. So this is all like super important. Know all this. Okay, we've already said this. Plasma about 55% is a yellowish color. Formed elements about 45%. There are 3 kinds of blood cells in blood. Red blood cells, which are also known as erythrocytes. White blood cells, which are known as leukocytes. And platelets or thrombocytes, which are little fragments of cells which play a vital role in blood clotting. Is this important? Oh yeah, you know all of it. This is incorrect. Origin of blood cells. All blood cells are created in red bone marrow, myeloid hemopoiesis. They are not created in lymphoid tissue, but they undergo processing and maturation in lymphoid tissue. Here it shows them drawing some bone marrow out of the hip. Hemopoiesis is the word for creating blood cells. It takes place in the red bone marrow. Why do we say red bone marrow? Because there's also a yellow bone marrow, which is fatty and inert. The origin is a stem cell influenced by specific growth factors. So a hemopoietic stem cell gives rise to these 5, which gives rise to the different sorts of cells we have. So the prourethroblast makes red blood cells. The myeloblast makes some of the white. There are 5 different white blood cells. We'll get to that in a moment. Here are the 5. And then a megakaryoblast makes platelets or thrombocytes. But they all come from the same hemopoietic stem cell. And all this takes place in the red bone marrow. Now we're going to go over all these separately. So bone marrow depression occurs if bone marrow cannot produce enough blood cells, also called myelosuppression. Results: aplastic anemia. We don't have enough red blood cells. Leukopenia. We don't have enough white blood cells. Thrombocytopenia. We don't have enough platelets. Pancytopenia. We don't have enough of any of it. Overactive bone marrow leads to excess red blood cell production called polycythemia vera or secondary. Overactivity and excess production of blood cells increase viscosity because there's more cells in it. Elevated hematocrit, you don't know what that is yet. Elevated hemoglobin, you don't know what that is yet, but you will, trust me. Polycythemia vera burdens the heart, overwhelms clotting system, causes beet red face and palms. Phyllis George, the famous sports announcer, the lady, died from this a couple of years ago. Treatment includes drugs, bone marrow suppression, phlebotomy, removing of blood. Okay, the most common cell in whole blood are red blood cells or erythrocytes, or RBCs. Perfectly acceptable to call them RBCs. Made in the bone marrow, they carry oxygen from the lung to all body cells. The blood protein that does that is the hemoglobin molecule. Now, it also carries carbon dioxide too, guys, and that's super important. So erythrocytes are made constantly in the body, and they don't have nuclei. They're anucleated. Now, of the white blood cells, there's 5 different kinds. You might as well learn them right now. They are eosinophils, basophils, and neutrophils, which are called the granulocytes. Why? If you look at them under the microscope, they got little granular things. And then lymphocytes and monocytes. Those are the 5. And then there's thrombocytes or platelets. Either word is acceptable. Platelets easier to say. This is super important. You must know this. You must know it. You must know it. Okay. An immature red blood cell is called a reticulocyte. A lab test of retic count. Why would we want to know that? If you have a person has an abnormal number of reticulocytes, guys, then something's going on. They're losing mature red cells. Maybe they got internal bleeding or something, and their body's having to make more, and so there's an abnormally large number of reticulocytes. Shape large, disc-shaped, and flexible. It's a biconcave disc, like a throat lozenge. Because the red blood cell can bend, it can squeeze its way through tiny blood vessels like this. And yes, they do that, guys. I've seen actual photographs of it. Some of the little capillaries in the body are so small that the red blood cells have to squeeze down in single file. Flexibility allows red blood cell to deliver oxygen to every cell in the body. Yeah. Again, the molecule that transports the oxygen and the carbon dioxide is called hemoglobin. Globin shapes the red blood cell. Heme carries the iron. Hemoglobin has an atom of iron, the element iron, in the center. And it's necessary. We have to have iron in our diet in order to make sure that we have enough hemoglobin. Okay, moving right along. Oxygen carriers. Large disc shape, yeah. Bendable, yeah. Contains hemoglobin. Hemoglobin, here's the abbreviation, contains 4 globin chains. Here they are, chains. They have an atom of iron. There are millions of hemoglobin in each red blood cell. Guys, anything in a biological system is so incredibly advanced and complicated, it is mind-boggling, and this is no exception. Hemoglobin responsible for red blood cell function. Each globin has a heme group. That's where the heme in hemoglobin comes from. Carries both oxygen and carbon dioxide. Globin transports red blood cells, transports carbon dioxide. Heme carries iron. Iron carries the oxygen. So here's what it's saying. There's a bunch of hemoglobin molecules in every red blood cell. There consists of a heme and a globin portion. And the heme has iron atoms. They transport oxygen and carbon dioxide. Again, we've talked about this. The shape, they're a biconcave disc, which means they have a sunken-in portion on each side, here and on the back side. Red blood cells bend, fits through tiny vessels, deliver oxygen. Sickle cell anemia, red blood cell does not bend, blocks vessel balloon, fails to deliver oxygen. We'll talk about that later. And he says cytosis, unequal size, poikilocytosis describes the shape of the RBCs. All right, guys, all these things are done in lab tests. We'll be going over it some more. If you have the African American people, some have the inheritable disease of sickle cell anemia. They're misshapen, so they have trouble. But they're resistant to malaria. And if you live in a country, third world nation, where malaria still kills 1 million people a year around the globe, then it's good to have some sickle cells in your. That's why it evolved. Why blood changes its color? Oxyhemoglobin, oxygen binds loosely with iron. Why is iron abbreviated Fe? Because it was known from the Latin, Roman times, that's Latin. Makes blood bright red. Lack of oxygen makes it bluish red. Cyanosis is a sign of hypoxemia, not enough oxygen. Cyanosis is lack of oxygen. If the person's having a heart attack, their lips and their nail beds will start turning blue, and then their skin will start turning blue. Or if they're unable to breathe sufficient. Okay, substances essential for hemoglobin production. Well, you have to have healthy bone marrow. You have to have enough iron. We get iron in our diet. You have to have vitamin B12 and something called intrinsic factor, which is found in the stomach. You have to have folic acid, one of the B vitamins. You have to have healthy kidneys and a hormone called erythropoietin that the kidneys secrete. An absence of bleeding and hemolysis. Hemolysis is damage to red blood cells. Now, guys, we're going to keep going over all this separately, so don't start freaking out yet. Okay, regulation red blood cell production. Oxygen levels are low. Kidney secretes erythropoietin, EPO. This is important to know. For some reason, guys, the kidney produces and secretes the hormone that controls the amount of blood production of red blood cells. Red blood cells increase, thus increasing the oxygen. There are oxygen sensors throughout the body. Yes, it is complicated beyond belief, like everything else in living things. Okay, red blood cells are produced constantly in the body, and as they get old and worn out and ragged, they're filtered out by the organ, the spleen, and they're recycled. So here's an old one, like me. The hemoglobin is broken back down. The globin goes back to amino acids, the building blocks of proteins. The iron is stored or recycled. The rest of the heme is what's known as bile pigments or bilirubin, and it is in turn is used to make bile, which is used for digestion of fats. This takes place all the time. Now, if we start turning yellow in our skin and the whites of our eyes, that's called jaundice. You can have hemolytic jaundice, rapid breakdown of RBCs, immunological or transfusion mismatch. Hyperbilirubinemia means too much bilirubin in the blood, yellow stained tissue. It also, guys, is a sign of liver problems. Primarily, that's what it's known as. But it can indicate a hemolytic problem too, because bilirubin and all, which makes you yellow, comes about from the recycling of these things. Normal rate of red blood cell breakdown, but diminished excretion of bilirubin in a bile, liver, gallbladder disease, obstructive jaundice. Okay. I would say most of it's this. There's also a neonatal jaundice in newborns. That's a different situation. Anemia, insufficient red blood cells, or insufficient amount of hemoglobin. They need to add that there. This is misleading. Red blood cell production falters if conditions or disorder or necessary substances are missing. There are many kinds of anemia, more than these three, quite a few. Sickle cell hemolytic anemia, something's happening to your red blood cells. Hemorrhagic anemia, you're bleeding somewhere, dude, and so you don't have enough red blood cells, or they're not able to carry enough oxygen. Iron deficiency anemia is the most common anemia. Now notice I didn't even mention that there. They will in a minute. To me, guys, I would put the most important ones, the most common that you see clinically, first. But I don't write these, so Iron deficiency is most common. Who do you see it in? Women of childbearing age. How come? Because they're losing blood every month, man. So they need iron supplementation in their diet. Pernicious anemia, lack of vitamin B and folic acid. Hemolytic, something's happening to them. Aplastic, not enough's being made. Anemia, chronic renal failure, it's going out through it's escaping through the kidney. Sickle cell, hereditary disorder among African American black people, hereditary. Or if you're just losing some, guys, hemorrhagic anemia. If you've got say stomach ulcer and you're bleeding, and that'll make it too. So anemia is not just a lack of red blood cells; it's also a lack of functioning red blood cells that have enough hemoglobin and iron in them and all too. You can have massive amounts of normal amounts of red blood cells, but if they have insufficient hemoglobin or iron and all, then they still can't do the job. Example, that's iron deficiency or pernicious anemia. Okay, how much time we got? Less than a minute. White blood cells. There are 5 different kinds. They're called leukocytes. Basophils, eosinophils, neutrophils, lymphocytes, and monocytes. Now, the reason they're classified as granulocytes or agranulocytes is the 3 granulocytes look granular when you look at them under the microscope. The most common are neutrophils by far. They fight bacterial infections. What do neutrophils do? They fight bacterial infections. The next most common are lymphocytes. Lymphocytes fight viral infections like COVID-19. The other 3 have other functions, and they're less. There's a very small number of eosinophils and basophils. Okay, we're about to run out of time here. We come back. We'll continue with red blood cells. Dr. Tom is going to sign off, and I'll see you in a moment.